Hi, do you ever wonder if your pelvis is out of alignment? Do you suspect one of your legs may be shorter than the other? Have you ever experienced pain around the buttock area or the groin area, which made it hard to stand or walk? Pelvic dysfunction can happen at two major joints. The first one is called the sacroiliac joint, or the SIJ, which is formed by the sacrum and the ilium bones. The second one is the pubic symphysis, which is located here, where the two sides of the pelvis join together. So both joints may cause significant impact on the lower limbs and the spine if they do not function properly. The normal movement for the SIJ is anterior and posterior rotation. If one side of the joint is stuck and cannot rotate freely, it will cause leg length discrepancy. Also, the normal movement of the pubic symphysis is up and down. If one side of the pubic symphysis is stuck here and cannot move up and down freely, it will cause a leg length discrepancy as well. Now, imagine if one side of your leg is 2 cm shorter, how would your body react? Your body would tilt sideways and your head would tilt the opposite side to keep you balanced. This will lead to a condition known as scoliosis, that is sideways curvature of the spine, and scoliosis may further lead to a range of problems such as stiff joints, stiff and dysfunction joints, tight or weak muscles, as well as poor posture and poor appearance. So now, let me demonstrate one test for checking the alignment of the SIJ. Now we are going to examine whether the patient has any SI dysfunction. So the first thing, we have to lie down the patient and expose the medial parts or the inner parts of the ankle, and then we have to check whether it's level. After that, now I need the patient to sit up and see if the medial parts, if there is any differences afterwards. So can you sit up for me, please? Okay, good. So now you can see that the right side of the ankle goes even further when the patient sits up. So it indicates the leg length discrepancy is mainly caused by the SIJ dysfunction. Let me demonstrate one technique to correct the alignment. We'll do a chiropractic adjustment. So first, we'll preposition the patient into a certain position. Now I need you to a little bit tap a little bit more. That's good. That's good. Okay. And then find the joint, the SIS, and then contact here. And then I need you to take the first in and out. Okay there? Yep. Listen again. And now. So that should help the SIJ dysfunction. Now, we will demonstrate the test for the pubic symphysis. Okay, so to identify or to check whether the pubic symphysis is causing the problem, we can ask the patient, first of all, we can lie the patient down first, and then we can ask the patient, okay, can you help me to do a hip hitch for me, like this? Yeah, that's very good. Okay, so now, also, can you try to push your leg down as well? That's good. So usually, if the patient have pubic symphysis problem, they'll have pain around the groin area, anterior groin area, which is up here, and also indicates the movement is limited in pubic symphysis. To correct the pubic symphysis problem, this is what we do. To correct this pubic symphysis problem, we will have to ask the patient to find where's the location of the pubic symphysis. So can you find the bony part around the groin area? Yep. Okay. So I'm going to put my hands here. Is that okay? Okay. So first thing, I'll have to put my hands here. And the other one here. Okay. So I need you to keep hitching in. Good. And relax. Okay, do a couple more times. 2 and and relax. Last one. And relax. That's an advanced way or another way to do this mobilization is giving the belt to a patient and put it underneath his leg and ask the patient to pull his leg up during the mobilization. So same thing. Okay, can you find the burning part for me again? I'm going to put my hands there. Okay, so this one. Okay, and then I need you to just hip hitch for me. Hitch, good. Is there any pain? No. Okay. And then can you pull with your hands as well? Okay, pull a bit more, good, and relax. This can help to clear the movement restriction in pubic symphysis. SIJ and pubic symphysis alignment issues can contribute to conditions not only locally in the lower back area, but also remotely in the neck or the leg. So the pelvis is the center of this body, and the position of the pelvis determines your overall posture. If your pelvis is rotated or tilted, then your neck and back will also out of place. Therefore, it is important to have a normal, healthy pelvis if we want to have a good posture and function for the whole body. If you want to know more about us, please make sure you like our Facebook and visit our website. There are a lot of useful videos and resources that can help yourself at home or at work. If you have any questions, you can email me adrian@painfreephysio.com or call me at 1-800-115-995. 1800-115-995. We sincerely wish you pain-free.